Today we're going to be talking to you about child and adolescent suicide that's related to depression. I'm Courtney, and with me today is Celeste, Rosie, Lauren, and Cassidy. Before we present all of our information, we want to let everybody know that suicide is 100% preventable.
So with that in mind, we want to talk about the most common causes of suicide. The usual underlying cause of a child or anyone's decision to end their life is depression. And in general, the number one risk factor for suicide is a psychiatric condition, such as major depressive disorder, but it may also include things like schizophrenia or even substance abuse. These illnesses may appear alone or together. For example, a child may have major depressive disorder and use substance abuse as a coping mechanism. The following causes of suicide are also causes of depression. Knowing that depression is often the foundation of suicidal ideation, this connection makes sense. Recent losses may lead to a child to consider or attempt suicide. When we hear the term recent loss, we usually think death of a person, but this term includes environmental losses as well. A loss may be the death of a family member, a friend, or even a pet, or it may be the loss of a space or time that was important to the child. This would look like moving to a new city or a new house, parents divorcing, or even just switching schools. Even though the house, parent, or school is not dead, it is no longer functioning in the same role in the child's life, and so this is a significant loss to them. The next cause is family history, and this is another risk factor for suicide. If a family member has committed suicide, a child is more likely to idealize suicide as well. The child may identify with or idolize the family member who killed themselves. There are also shared values, ideas, and experiences in families. It is likely that a child will have a similar genetic and environmental profile to a family member, and this may impact their choices. The final significant cause that we're going to talk about today is the lack of social support. We are social people in all areas of our lives, and so this deficit can occur in any area. Some common areas, though, are school and home. This might look like neglect, abuse, or bullying, and may come from parents or peers.
So children can attempt suicide in many different ways. Working in pediatrics and in a hospital that these patients come to us in crisis, I've unfortunately become very familiar with ways that children go about trying to commit suicide. They can do things such as ingestion as well as physical harm. Things they tend to ingest are their own medications if they are currently being treated for things like anxiety or depression, their parents' medications if their parents have depression or anxiety. But most common things are just out of your typical medicine cabinet, such as Benadryl, Tylenol, cold medication, and oftentimes drinking too much or a combination of all these things. Physical harm includes hanging, cutting of their thighs, stomachs, wrists, anything that either they want to be seen or hidden, running in front of cars, or even using a gun. Personally, I have seen all of these attempts, and like Lauren said, especially if a family member has had or committed suicide, the child will often attempt the same way that their family or friend did as well.
So medical interventions are kind of situation dependent. So if an adolescent or a child were to have ingested certain medications, we would want to give them things like activated charcoal, which would bind to the substance they ingested and then help clear it out of their system, or help bind it before it gets into the system. There's gastric lavage, just to kind of wash out and like pump the stomach and get anything out that was ingested. And then there's also specific antidotes for different drugs, things like flumazenil, atropine, naloxone, kind of the typical antidotes for major drugs. And then if the child would need wound treatment or laceration treatment, if they did try cutting or some other form of physical self-harm, we would want to do wound treatment, give the tetanus toxoid shot if they used something with metal to do that harm. And then there's also pharmacologic treatments that we can do if they're kind of at the peak of their crisis, they're really anxious or manic. We could give them antidepressants, different antipsychotic medications, and then so there's both short-term medications, then longer-term medications as well. And then, so we want the patient to be mentally stable before we move on with any further treatment. So once we do that, then some other forms of treatment that we could do in the emergency room would be getting them a mental health consultation right away, especially if they had a previous attempt, just because that mental health is so important. And then we would want to admit them into a psychiatric hospital. Hospitalizations have been shown to be the safest course of action for an adolescent who's had a suicide attempt. We would also want to be doing psychosocial and emotional assessments just to kind of see where that patient is at. And then for longer term interventions, things as simple as locking up firearms at home or keeping medications in a safe cabinet. And then longer term medications that would treat the underlying cause of the suicide. We could use tricyclic antidepressants. That would be something like clomipramine. We could also do SSRIs, which are a little bit safer for kids. That would be things like Zoloft, Celexa, and there's a lot of other different medications to choose from.
All right, I'm going to be talking about nursing interventions for the suicidal adolescent or child. So in nursing interventions, we have ourselves for a nurse-patient relationship, the environment or milieu, and medication. So obviously Celeste just covered medication, so I'll be talking about what we as nurses can do in our relationship with the patient and the environmental control. So first of all, the most important thing that we have to do with suicidal patients is establish trust and rapport, because further down the road they're not going to respond to treatment or open up to us about any plans that they might have for self-harm if they don't feel like we're safe people to talk to. Alongside of that goes encouraging honest communication and really opening up the lines right away, asking questions and encouraging them to express feelings and thoughts. There are a couple different screening mechanisms we can use to determine if a patient is considering suicide, and there's tons of different types of screenings, but a couple of the most used are the HEADS, the Columbia Suicide Severity Scale, and the ASQ, or Ask Suicide Screening Questions. So the HEADS really is something that healthcare providers or nurses can use very easily to determine any risk factors that an adolescent or a child may have. And these are things like home environment, education, eating habits, their interest in activities, drug use, sexuality, risk factors, or signs of depression, and things like that. The Columbia Suicide Severity Scale, or CSSRS, focuses more on the suicide ideation part and suicidal behavior, so seeing if they've had any prior attempts or if they do self-harm at all. And then the ASQ is a very quick and easy 4-question tool used mostly in emergency rooms when suicide is suspected. Again, focuses on a lot of the same questions. And these are really just screening tools. They don't really go in depth with assessment. So as a nurse, after doing the initial screening, if these patients were at risk for suicide or had any, you were at all suspicious that they were suicidal, you would do a deeper assessment right away. And as nurses, obviously our huge first line of defense is thorough assessment, because there are things that can go missed if we don't ask very direct questions. One myth that a lot of people believe is that if we ask people directly about suicide or self-harm, that this will actually make them commit suicide or attempt suicide, but that's actually not the case. Most of the time these people, and in this case kids, really just need to be seen and heard and really want to tell someone what's going on. So first of all, asking direct questions, like I said, asking if they've ever even had thoughts of hurting themselves or committing suicide, even if they haven't actually done anything outright. And if they say yes, or they have thought of that before, asking about the method, if they have a plan, kind of going deeper into what they have thought about, and then assessing the lethality of if they were to attempt, how likely would it be that they would actually be successful. And also an assessment asking about previous attempts. A lot of people attempt suicide more than once, and so assessing, again, the method and their response to treatment the first time that they attempted suicide. Lastly, assessing for things like Lauren talked about, comorbidities like substance abuse, recent losses, other mental illness, and specifically depression are very common things to have alongside with suicide. After the assessment, it's really important to establish what's called a safety plan with the parents and the child. And so this includes kind of agreed upon plan that you form with the child and the family and the healthcare provider that you establish to recognize the signs and symptoms that depression could be worsening or maybe leading towards suicide, agreeing upon coping strategies that they could do besides self-harm or things that would be hurtful, using social contracts to distract from thoughts of suicide, contracting family members to help deal with their crisis, and helping them agree to things like if they are feeling suicidal, that they'll come in and actually take action towards getting help for themselves. Another thing we can do as nurses is establish a no suicide contract. So having them sign something that says that they're not going to try to do something to harm themselves while we're out of the room. Collaborating with other healthcare professionals is vital because we're always, as nurses, the go-between between the patient and the provider. Ensuring patient adherence to medications and therapies, whether it's group counseling sessions or one-on-ones. It's really important that these people stay adherent to the treatment plans that they've agreed upon. And then lastly, before discharge, another huge nursing intervention is education of both the patient and, because this is going to be a child or an adolescent, education for their family. So knowing the signs of suicide, establishing a follow-up plan, and preventing access to harmful weapons. Milieu management. So this is kind of the last part of our 3-part nursing plan of us and medications and the environment. So obviously the biggest thing with managing the environment is providing safety, and this includes both physically and emotional safety. Obviously the biggest thing we want to do as nurses is prevent suicide. So identifying risk factors, again, going and doing that thorough assessment, frequent observation, which can either be a level 1, which is every 15 minutes, or a level 2, which is continuous observation with a one-on-one staff member. Ensuring that they have no access to dangerous objects or medications that they could use to commit suicide. And helping them identify support systems that they can use to help them.
So it's really important to see that the nurse is kind of the key element for this care. They're kind of the leader, and they kind of really bring this collaborative care together. So I just want to go over a couple different areas that and interprofessional collaboration for other staff and just resources for the patient dealing with SI. So what I liked about this was children compared to adults for SI, they have a lot of different resources because they're dealing with that growth and development and then also the emotional part. So with the interdisciplinary team, us as nurses, we know our role, and that has been discussed. But some other important parts are like the dietitian. So for example, food is really important. Food is going to also kind of collaborate with your medications. So some medications, for example, may have a lot of weight gain, or you may have to watch your sodium. So it's just important to incorporate that healthy diet and then just be aware of those side effects. And then educator. So everyone on the team is considered an educator, and that's important to know. Education is going to come from different angles. So just like the nurses and the dietitian, they're going to go over different aspects of that education, but every individual on the team is an educator. Recreational therapy. So this is so important because people sometimes forget about recreational therapy. This is where you want to take that leisure time balanced with work. So the book talks about the Wellness Recovery Action Plan. It's called the WRAP, and this is used by certified peer specialists or other staff to help patients create their own plan of care for staying well during a process by decreasing negative thoughts, increasing empowerment, improving quality of life, and helping achieve life goals. So they did some research on this, and they found this was one of the most effective ways to help adolescents with SI. So psychoeducation is another one. There's a lot of different topics that people can go over with psychoeducation for educators, but some can be basic information from using public transportation to recognizing your signs and symptoms of SI to talking with your therapist. Group therapy is also important, so that kind of falls in line with the therapists that are on the team. Spirituality groups are important because, again, we want that holistic care. We don't want people to just get the care with medication and nursing care, but we also want to incorporate spirituality care. OT is also important for functional abilities. So OT is used a little more than PT just because we want to make sure that people can incorporate this into their everyday life for mastering those self-care skills. Pediatric mental health specialist is just for pediatrics. So this is an individual that's not a doctor and not a nurse. It's kind of a mix of people. So you can have a degree from different backgrounds that are usually emphasized in psych, and what they do is they do a mix of things where they do assessments, they have referrals, and this was shown to actually really decrease time in emergency rooms because they sit down with individuals that are having these crises and they kind of lead the individual to the right direction and the right resources. The physicians are going to be the ones that diagnose and they treat the illness and the injury, and then the psychologists are going to be the ones that also assess and diagnose, but they're going to look at more of the psychological issues, so they both work together. Social worker is going to help make the referrals and link the family together. And then speech and language disorders. This one was kind of cool because people don't always think about speech, but it was actually done for research that a lot of people that have trouble speaking or have speech impediments or just have that different way of thinking, maybe a negative behavioral thinking, that they can cause SI. So you want to have that positive thinking, and then you also want that cognitive behavioral therapy as well. And then some other things that I experienced when I worked at the psych hospital, they had a lot of individual therapies and then music therapies, so those really helped the patient as well. In conclusion, it's important to keep in mind that suicide is 100% preventable. And with this, I just like this picture because this really shows, again, the collaboration to prevent this suicide. Many children are going to have factors that contribute to suicide, and the main one we go over is depression related to that. It's important for nurses to recognize that SI and then implement the proper actions and provide resources. The priority for SI is treating the initial issue, stabilizing, and then continuing long-term therapy. And in order for nurses to be holistic, it is important to treat the physical and mental issues, which provides the best success for patients. So thank you. And here are our references.